a rooftop tower, and you get to look over the pier, and you just see for miles on the city. And it was night, and we picked the night that they ended up doing fireworks and stuff. And that was probably one of my coolest and favorite experiences. Hello, everyone. My name is Dr. Dylan Callier. I'm a physical therapist, and welcome to the New Medical Nomads podcast, where I get to document my journey as a medical traveler, as well as interview other experts within the traveling field. Now, the rules for the traveling game are constantly changing, so anything you hear on this show should be for entertainment purposes only. This is not legal, financial, or medical advice. Enjoy the show and safe travels. Hello, everyone, and welcome to another episode of the New Medical Nomads podcast. My name is Dylan, and today I am with Ashley Stenger, who is a traveling respiratory therapist. Ashley, where are you at in the world right now?
I'm currently in Milwaukee, Wisconsin, and I just moved here about 2 weeks ago.
Okay. I know we had tried to schedule this episode a little bit before, and you were in between contracts. Where were you coming from?
I was in Detroit for 13 weeks. Detroit,
Wow. Okay.
Michigan.
Got it. So I guess just to start out with, can you tell us a little bit about kind of how you got into travel therapy, starting with how long respiratory therapy school is, how you got interested in travel, and how long you've been doing it?
Sure. So I did not know what I wanted to do in school. So I kind of dinked around for 3 years, took really random classes, fell into respiratory therapy, which is an associate's degree. But you can also get a bachelor's degree in it. A lot of people get their associates and just do a bridge program. Apparently the school that I was going to in Indianapolis was like the only bachelor program in Indiana. So I was like, well, I'll just do it, maybe I want to go back to school one day, maybe I want to teach, it'll open some opportunities for me. So it took me 5 years to get through there just because I probably figured it out about the third year of college that I wanted to do respiratory therapy. Graduated with my bachelor's and started in 2012. I kind of heard about traveling like after a year of me being at the hospital I was at and kind of was interested. There's this story of like you're with your ex-boyfriend and then you break up and then you want to go find yourself. So I had bought a home in Indianapolis, like grew up really fast, had a mortgage, I was paying my student loans. My student loans were double my mortgage, and that was like minimum payments. I went to private college, so I owe a lot of student loan debt. I went to Europe for 17 days with a bunch of strangers, and caught the travel bug. I was like, I want to do this. So I just looked into it and talked to a bunch of people, reached out to a bunch of people, and once you open up your world to traveling, you just find a bunch of people who are traveling. So I put my house on the market, and my realtor was like, well, the area's kind of getting rough, so it might take, anywhere from 6 months to a year to sell it.
Wow.
So I kind of just went PRN with my job, which is just like as needed. And I was like, well, I'll just stay in Indianapolis until my house sells, just keep an eye on traveling jobs and getting some, apply to some recruiters or apply to some travel positions, talk to some recruiters, just kind of got my toes a little wet. Wasn't really like expecting anything crazy. And my realtor had put my house on the market, and I had 2 showings, and I got a full price offer the second day.
Wow, very cool. Yeah.
So I was like, well, I guess this is God telling me it's time to start traveling. So my dad had some health issues that summer, and I wanted to be close to the family. And plus, I was like, well, if I don't really like traveling, I only want to be a couple hours away from home. So I got my Michigan license just because it was the summer, and I heard there were a lot of Michigan jobs in the summer. And I got my first job out there and was starting within, I think it was like 2 or 3 weeks. This was in 2015. And loved it there. It was a small little community hospital. I was the only respiratory therapist. Met my boyfriend out there, and I've pretty much stayed in Michigan the past 2 years. I've taken a couple random assignments.
Okay.
And yeah, that's kind of where I'm at right now.
Okay. So you've been traveling for 2 years then?
2 years. I took a year off to get
Okay.
some pediatric ICU experience, just to be a little more marketable.
Yeah.
And there was discussion of the RV life. It's a lot more difficult than it leads on to be. For some people, it just seems like, oh, you can just go buy an RV and go. I have a 95-pound dog, so that makes it a lot harder to travel with.
Yeah.
So me and the boyfriend were going to go with the dog, and it kind of didn't pan out that way. So I'm just kind of trying to stay Midwest for right now and just see where it takes me after this.
Got it. That is an awesome story. Just kind of,
Yeah,
I want to do this, selling the house and going. That's really cool.
Thanks.
Yeah. Something you hit on, and I completely agree with and I feel like where a lot of the interest is coming from with new grads and students is that the student loans are so high. You mentioned that it was twice your mortgage rate. And I think that's not the primary push for people to go and see places. I think everybody wants to kind of get out there and see the locations, but definitely providing a heavier incentive for people just coming out of school to go into being a medical traveler.
Right.
Is that something that a respiratory therapist can do straight out of school?
Absolutely not. They want at least a year. In my opinion, I would highly recommend 2 years because we are so versatile. We are literally the first people to show up to a code blue situation. So you need to be comfortable with your skills. You need to kind of prove to everybody that you know what you're doing because it is your license on the line, and you're nothing against the recruiters, but they're just doing their job by trying to get you somewhere. They don't know your comfort level. Only you can. So you just kind of got to cover yourself. We are all over the place: ER, ICU, med surg, NICU, PICU, everywhere. So I would highly recommend just getting experience in every unit you can before you decide you want to travel.
Got it. You mentioned units. The only time I've gotten the opportunity to work with a respiratory therapist is when I was in the ICU or in the acute hospital setting. Are there other settings? Right. Is it only in the hospital? Do you guys get jobs out in like SNFs and places like that? Or is it just specifically within the hospital?
Yep. SNFs, you mean like long-term care, right?
Yes. Mm-hmm.
Okay. Yep. So a lot of the patients that go to SNFs or long-term care are patients with artificial airways, specifically trachs. And they usually have to be on the ventilator or life support. So they do staff respiratory therapists there. There is a lot of educational opportunity with respiratory therapy as far as teaching at the collegiate level. And you can do pulmonary rehab, which is really awesome. Unfortunately, it's kind of hard to get a job in it because funding and stuff like that, and a lot of nursing is getting pushed into, it's called cardiopulmonary rehab at some places. So a lot of the nursing has been taking over it. I loved my clinical rotation at pulmonary rehab because you get to work out with the patients, you kind of monitor their vitals, just make sure they're breathing all right. When they kind of have issues breathing, there's certain breathing exercises you can cue for them. We can do breathing treatments outside of the hospital. There is home health you can do as well. And then people who have sleep apnea do have CPAP and BiPAP machines at home, which is just provides pressure in the airway for people who snore. So respiratory therapists do manage those types of things too in outpatient clinics. So there's a lot of opportunity. A lot of those jobs are really hard to find because people like to stay in those jobs. Mm-hmm. A job that I would really love to be a part of one day is an asthma educator. It's sometimes in a doctor's office, people just come in, you educate them on their inhalers they should be taking, you educate them on their disease process or COPD. You educate them on how to take care of it. If it's getting this way, maybe you should go to the hospital, maybe you should take this. That way it tries to keep the patients out of the hospital, but unfortunately the funding's not there for a lot of places, so we just leave them in the hospital.
I see. Okay.
Yeah.
Can you describe what it's like to kind of go through the orientation process or first showing up for a job opportunity? Going through the orientation, and then are you more team-based where you're interacting with a lot of the other healthcare professionals, or is it pretty much just you on your own with the patients?
Absolutely. It's always team. People usually don't know who we are. They just think we're nurses.
Okay.
And that's fine. We're very specialized. But we work one-on-one with the nurses and the doctors. So not every patient needs a respiratory therapist, but every patient needs a nurse.
Mm.
So the patients who have those pulmonary disease problems, or have issues breathing, or we're the first one they call, like, okay, my patient's having trouble breathing, come check them out, and then they will become our patient too. But we work side by side with the nurses. Most places we're a really good team together. We have a lot of say so, especially with the nurses, just because that's what we went to school for. So, yeah, it's really awesome. A lot of teamwork. Orientation is usually 3 days when you're on a travel job. Your first day depends on the facility. Sometimes they make you go through general orientation, and those are the hospitals that usually don't have travelers. Most of the time, it's here's the unit, here's where you're going to be working, here's the team. This is how we chart. Sometimes they'll make you do like a 8-hour charting day, because to me, the most difficult thing about traveling is learning how to chart their way.
Okay.
Because charting the correct way on a computer is the way to show how our productivity and how we can charge the hospital and the patient. That way we get our department gets reimbursed. So if I'm not doing the job right, it's like I'm not even there if I don't chart right.
Right.
So that's usually the first day, and then the next 2 days are with somebody. You do your job, but they're pretty much there, like making sure you're charting right, making sure you don't have any questions, and that way they're there for you. So that's what I mean by, like, it's really important to be confident in your skills. Yeah. Because you're literally thrown to the wolves. Like, that's what traveling is. Like, you know what you're doing. You just need to figure out how to do it at that specific facility.
Got it. Yeah. You mentioned briefly about productivity. How many patients do you usually see per day, or expected to see?
That's a huge, huge question. It depends on the unit you're on.
Okay.
Right now, I'm at a children's hospital, so the acuity is a little lower, just because children have a lot more things that we can do for them, and kids with chronic diseases are very sick, so we have to spend a lot more time with them.
I see.
So right now, and it's like a children's ICU, it can be anywhere from 5 to 10 patients a day, depending on how many admits you get. Med-surg floors, when I've traveled, I've had 14 patients in 4 hours. So it just depends on where you go. Those patients, you're assessing them, you're doing a breathing treatment, and you're leaving the room. So it's really, really short time with your patient, and it's pretty much the same thing with every patient. And then you'll probably see more than that in 4 hours, because nothing ever goes smoothly in your shift. So.
Okay. So in your multiple years of traveling, what's something that you wish you would have known starting out?
I have to write some of these down, because these are really good questions. Let me look really quick. I wanted to see what I wrote. I had to think about it for a while.
All right.
I know what it is. I have the answer. Very important. So I would recommend, I would not recommend getting a lot of state licenses when you first start. Maybe just start with one place that you know might have a lot of job opportunities when you're ready to travel, and one that you could probably see yourself going to more than one time, and then go from there.
Okay.
I applied for about 6 different state licenses when I first started, and all my recruiters were like, "That's so awesome. We want you, of course. Like, I already paid for everything. I'm ready to go." Like, that was my plan. Like, I want to be able to go to California if that's where I want to go. But with that being said, you have 2 years to renew that, which is another fee, and then you have to keep up on the continuing education credit. It's a lot of headache, a lot of paperwork, and every time you apply for a new state license, you have to get a verification from all your other states that you're licensed in. So that could take longer to get licensed than the state you actually want to get licensed in, and it's a lot more money. So.
Got it. How did you keep up with all the CEUs? So I imagine, at least for physical therapy, each state is different with the hours that they require, and some of them even go into like 6 hours need to be ethical and 2 hours need to be documentation. Like, some of them get pretty nitty gritty. Right. How do you keep track of all those? Do you have a big Excel sheet, or what do you do?
I'm learning that there's like an app. I need to research it a little bit more. Someone had mentioned something about an app on, there's a travel group that I follow on Facebook.
Okay.
A lot of the states that I am licensed in just require the NBRC CEUs, which is like the professional boarding CEUs. Like the state of Michigan does not require specific CEUs for their state.
Okay.
So that's kind of nice. Because it's one less thing for me to keep track of.
Right.
My other states, like California, I applied for and got the license, and the renewal fee was like $300. So I wasn't going to renew until I was ready to go.
Got it.
So I haven't really kept up with that. All I did this year, because this has been 5 years since I've been in RT, so all I did this year was renew my CEUs for through the MBRC, and the states that I am licensed in, as far as I know, you don't have to submit them anywhere else, and it's the correct amount of CEUs that I need for all my licenses. So I type a lot of things out and keep them in a binder and just keep track of it that way. But it's super, super important to keep organized because it can get really crazy really fast.
Got it.
Yeah.
Have you had any quote unquote horror stories since you started? And if you have, how did you handle those? And how did the recruiting company handle that as well?
Yes, I have a classic horror story. So I went out to Virginia, and it was just kind of a last minute. My recruiter really was good at recruiting. There's a lot of money. We can start you next week. It's out in Virginia. I had talked to the boyfriend about it, and I'm like, we're really far away from each other. And he's like, don't worry about it. We'll make it work. You want to pay off your student loans? Like, think of your goal. So I went out there, and the facility was, the people that I worked with were great, but it was, to me, I felt like my license was on the line every single day that I went to work. The management was aware at how bad it was, which obviously is why I was there. But they weren't recruiting any more travelers. It was just me, and one had just quit before me. I would literally go home. I am not a crier. I would literally go home every day from work, after work, crying on my 40-minute commute home.
Yeah.
Like I was just like, I didn't chart something right, and I'm not one of those people. Like, I try to leave work at work. Sometimes it's hard to do that. But I wasn't really properly shown how to chart. I wasn't shown how to charge. Their charting system was very old, something I was not familiar with at all. Their scanning and medicines and stuff like that was a whole separate charting system, so it made it more difficult. They had put me in very dangerous situations. So I did speak to the manager about it. She did not like the conversation we had. So she called my company and told them basically, like, she's a traveler. Why is she talking to me? Even though me and her, I thought we had a good conversation. I'm very professional, just so you know, like, are you trying to get more travelers in? Like, I'm feeling kind of dangerous here with the workload I have. And she's like, yeah, I'm trying to get more travelers in, but obviously that's why you're here. I'm like, I appreciate, you trying. And I thought I had a really nice conversation with her, and apparently she didn't like our conversation. My recruiter had the clinical person call me and basically tell me that I have no business talking to management, and if I had an issue, I should have went to my recruiter, which I had already done. I had already emailed her and said, listen, I don't know if this is going to work out because I'm really struggling. I feel very unsafe. She never reached out back to me. It was probably like a week later when I made this meeting with the manager. And they were not on my side. Like, you could tell them, like, do you not want to hear my side of the story? Do you not want to hear what's going on? She's like, you're there to help them, and that's it. You're not there to rock the boat, is what she said. And I was like, are you kidding? Like, what am I supposed to do? I can't. Money's not worth it to a point. You know what I mean? Like, it's a lot of money, all this stuff, but you have to think of yourself, because nobody's going to think of you when you're a traveler, and they just want the money. When it comes down to it, certain recruiters just think that way. So I gave them my 2 weeks notice, and I told them, like, I don't want to work with you anymore. I don't want to continue working with you. And they were like, 2 weeks, which ended up only being a week, even though I told my recruiter, I emailed you 3 weeks ago, consider that my 2 weeks. And I canceled my contract and drove back home. So that was, I never thought I would travel after that experience. It was really, really hard for me. I met some awesome people, and I was really sad to leave because Virginia is a beautiful, beautiful state. I did a lot of cool things while I was there. I just couldn't handle the hospital anymore.
Got it. And so the origin for that question, especially for the listeners kind of tuning in, is not to focus on the negatives at all or steer anybody away from it. But I think when people are fearful of going into travel, it's those ethical situations that they're worried, or the horror stories they hear about. And maybe they're unsure of how to handle those situations. So I want to get those types of scenarios out there so that if somebody else does run into them, they know exactly how to do it, steps to take. Unfortunately, it sounded like you didn't have a team on your side, so you had to throw in the towel and leave. That is the first time it's usually the stories I hear. It's like you and the recruiter figured it out. And if you have to separate from the hospital, then so be it, is usually what I hear. But that is the first story I've heard where it was kind of just you alone. Yep.
So needless to say, I will not work for that company anymore. Technically, I left the job, so I don't think they would hire me back anyway, which is fine. And I just, like I said, I was very scared to travel after that, but obviously it taught me a valuable lesson.
When that did happen, was that the first position that you took as a traveler?
No, and I think that would scare me away forever. Sad to say. And I hope if people do get in that situation, just know that they're not all that way. They get a bad egg, but do your research. That's what I've learned. Our travel community, no matter what profession you're in, is very helpful with looking out for each other. Nobody wants to go through a bad experience. Nobody wants you to go through a bad experience. Everyone's very supportive. That was my third assignment. So first one was in Michigan. I fell in love with Michigan. I loved the hospital. It was just too small for my liking. I was just ready to move on. The second job I took was in a trauma hospital in Indianapolis, and it was okay. But, once again, I was ready to leave, which is wonderful. And then this was the third one. And then I kind of decided, what am I doing with my life? I do live in Michigan. That's where my boyfriend is. Parents are very close to them, or close to him, because they live in Indiana. So I'm like, it'll be a good time to settle down and kind of figure out which route I want to go, because I was kind of getting burnt out. And I think Virginia did a lot of that to me. So I decided to work in the pediatric ICU for a year and kind of get that experience and maybe just broaden my horizon a little bit. So
Got it. When you were bouncing around to all those new places, did you have a routine that you kind of went through at each new place where you're trying to find a social group to fit in, or checking out different restaurants and places to eat or stuff to do?
I think I'm getting into that more now because I've learned a lot and stumbled through a lot of things in previous assignments. I love beer. It's a great way to bring people together. I love craft beer specifically. Grand Rapids, Michigan is where I was for a year, and they have like 20 microbreweries in their little city, and it just me. So love it. So I do go to breweries. Usually you meet some awesome people there, just sitting down and chatting. I'm a very extroverted person, so I can pretty much talk to anybody as long as they'll listen. And usually, I'm like, hey, I'm new in town. What would you recommend? I love getting recommendations from the locals. People, where are you from? What do you do? Where are you at? Like, just easy to start conversations that way. I also do CrossFit. So every time I go, it's like a thing now. Like, I can't accept an assignment until I make sure that there's a closed CrossFit gym. I know it's ridiculous, or where I'm living. So Milwaukee has been a great city for both of those. And, besides the working out, the community in CrossFit is amazing. They like beer. They like to go out and socialize. Just a bunch of big kids, doing fun workouts. And There's just a lot of camaraderie in CrossFit, so I love that. I used to run before that, so I would join just running groups.
Mm-hmm.
A big tool that has helped me, I know those were one of your questions, too, was meetup.com, and that has been very helpful, because I don't want to date anybody, obviously. I just want to meet people.
Mm-hmm.
You know, I don't even care what age you are. I just want to meet people who do similar things as I can, meet good people, and just, create a good day with somebody or whatever. When I was in Virginia, I was very, very, obviously it was a really bad experience for me, but I tried the best of it. Meetup.com was the first, someone had told me about it, and I'm like, oh, I don't want to date anybody. And they're like, no, like, it's for groups and stuff. So I literally searched like beer groups and hiking groups and all that, and I found this hiking group, and it was the most random group of people. And you just go out on a whim, you don't know anybody, you just message through whatever.
Mm-hmm.
And I had worked the night before, and they wanted to hike a mountain in Shenandoah National Park, which is about 2 hours outside of Virginia. Beautiful, beautiful place. Met these random strangers at a car park, and we just kind of got comfortable with each other for a little bit. Hi, my name's so-and-so, whatever. I'm not going to, bring you in an alley and kill you. I'm very trusting of people, so working on, I'm very open to everybody, but there's got to be some smartness to that. The main guy of the group was a Boy Scout, and he was very awesome and like super excited to have a newbie to show him how to hike and all that. And then there was 2 people who had just moved from Texas. So we hiked my first mountain I've ever hiked before, and it was one of the best experiences of my life. I connected with strangers, and we went on a couple hikes after that. And I mean, I still keep in touch with some of those people. But meetup.com has been very, very helpful as well. If you don't like working out or anything like that, they have like game nights and stuff like that. You can join in groups that'll go travel together, and it's free. So you can just type in your interests, and it'll kind of find in your area what kind of groups would match.
Got it. You were talking about just random people kind of meeting up. That reminded me, I forget which birthday it was, but I decided that I was going to go up to Chicago for the first time ever. And St. Louis is very close to Chicago, so it wasn't that far of a drive, but I wanted to take the train. It ended up turning into a bus ride, but got there. In the hostel that I was staying at, I ended up meeting 2 brothers from Mexico, 1 chick from Boston, and there was one Asian dude who I forget which nationality he was from, or which nationality he was, but then went to Canada, and then now he was traveling the U.S. So we just had this hodgepodge that decided to go up to this, I forget which tower it is, but it's a rooftop tower, and you get to look over the pier, and you just see for miles on the city. And it was night, and we picked the night that they ended up doing fireworks and stuff. And that was probably one of my coolest and favorite experiences so far. And this wasn't a question on the list, but do you have a favorite experience or anything that comes to mind that's kind of up there?
I'm really enjoying my time here. This is my first time that I've roomed with people. And I always take the housing stipend so I can find my own. And knock on wood, I've had a lot of good luck with that. But I really think, like I said, the hiking in Virginia was awesome. Meeting my boyfriend in Michigan was awesome because once I met him, I had a travel partner in Michigan. He showed me all of Michigan. He did not want me to leave. Very good job. I did extend my contract out there, and I've been obviously close in proximity to him. Yeah. But Michigan was an awesome, awesome experience. It's a beautiful, beautiful state. So underrated. But right now, like I said, this is a really cool experience too. Yeah. I try to find the good in everything, and every assignment has had a really good experience.
That's awesome.
When I was in Indianapolis, I was closer to my friends that I went to college with. I was close to my best friend and her kids. So that was really awesome. Because, if you're just going somewhere to work, it's going to be really, really hard, and you're going to have a hard time traveling because life shouldn't just be about work.
Right.
I think that's probably why a lot of people maybe don't like traveling, because they don't get out of their comfort zone, and they're not, people like us who can just meet random people or whatever. A lot of people do struggle with that. That's very difficult to have that personality and travel with.
Mm.
Definitely getting outside of your comfort zone. But I've had great experiences everywhere I've been, even though, I've been in some tough.
Got it. Got it. We kind of hit it already with the website that you're using, but any apps that you use or items that you travel that you think are kind of a must-have?
Well, I would say if you're single and you just want to like meet, somebody of opposite sex for beer or whatever, I was on Tinder, boyfriend,
Uh-huh.
uh, not ashamed. I wanted to meet people in the area. If there was some sort of app for like meeting other women, not in that way, but like in a friendly way, I would so be all over that. But there's not one that I know of.
Got it.
That way, because with Tinder, it's quick and easy. Like some people are in your proximity.
Mm-hmm.
You're on your phone. You can be like, "Hey, you want to meet at this bar or this coffee shop or whatever." Yeah. Have a good conversation and go your separate ways. That's kind of what I did. Meetup.com. Yelp has been very good, just for kind of like seeing what's around you in the area. I'm glued to my GPS on my phone. I'm like, the first 2 weeks, I can't even really talk to anybody on the phone because I'm always on my GPS.
Mm-hmm.
They really should make it to where you can be on your GPS and talk to somebody on the phone. I'm not sure why they haven't figured that out yet.
I know Tinder's a very popular app, and so I'm surprised no one's brought that up yet. I think it's probably on some people's minds, and they maybe just neglected. But I'm glad that you brought it up, because definitely a social app. And I can't remember when I started using it, and it's been off and on. But definitely when you're in a new area, even just to say, "Hey, what's something cool around here to do?" and you find all the hole in the wall restaurants or really cool places or really cool views and hikes and stuff that aren't necessarily on the top 10 things to do in the city or wherever you're at.
Exactly. You get it. See, everyone gives because, it has such a bad rap. And it's like, it is what you make it. You attract the people that you want to hang out with. So if it was someone kind of shady, I'm not into that. Like you said, I just want to kind of know the area. Do you want to meet for a beer? Like I said, most of the time it's ended with a beer and go our separate ways. Thanks for a great night. The end. Like, may or may not talk to that person again, but I wasn't really looking for anything specifically. Just like you said, I traveled a lot and I was in new areas, and it's just a really cool experience.
Yeah, absolutely. I ended up, this is a little, one of the embarrassing stories. So one of those horror Tinder stories, we'll go into that. I was new to a place, and it's probably the first week or two that I was there, and messaged just one lady, and I was like, "Hey, what's some cool things to do?" And she said, "Oh, there's like a museum nearby. We should go check that out. Meet me here." And she sent me like a street intersection. I was like, "Okay, cool." So went to the intersection. It turned out to be a playground, like where kids play, like small playground. And she had her like 2-year-old daughter with her during the time. And I was pretty cool with it. I'm chill with kids, like it's whatever. But the entire time, the child kept calling me, "Oh, hey, dad, hey, daddy," like stuff like that. I was like, "Oh gosh, no, oh no."
That's cool.
Kind of what you said. It was just a fun adventure, and then you don't talk to them again, and it's okay.
I've got some horror stories too, and it's like kid, like you said, you don't mind the kid, but you want some you time, or just go out together and not have a kid calling dad.
Or warn a person, like, come on. That's so funny. Any books or podcasts or personalities that you follow currently? And could be about travel, could be about something that you're interested in. I know you're a CrossFit girl. What do you follow, and where do you get your information?
So I've got a long list.
Okay.
I have recently gotten to the podcast world, probably about 2 years ago, and I feel like I've missed out on so much. Because some podcasts that I found have like 200 episodes. I'm like, I'm never going to get caught up. And then they just keep coming out with new ones. I'm like, no, stop. I need to catch up. So I love nutritional information. I love movement stuff. Anything to do with health and nutrition and fitness, I love listening to because it's constantly changing, just like healthcare. My favorite podcast, which these girls are awesome. I've met them. They're from Colorado. It's called Girls Gone WOD, and it's a real girl talk podcast.
Okay.
They do CrossFit, but it's not centered around that, which is why I love them, because it's for, all women.
Mm-hmm.
Talk about, kids, and the one girl has a kid and the other one doesn't. They travel, they get, get-togethers. I actually just recently, when I was in Detroit, I made a special trip out there to see one of my nurse friends that I used to work with. So that was really awesome to see her. And that weekend they did a 2.5 mile, or no, it was a 1 mile stair incline on the side of a mountain. And it's called the Manitou Incline in Colorado Springs. And I got to do that with them and Emily Schramm. So I was like nerding out. They're everyday people, and you listen to them, just like, yeah, they're my girlfriends, they're really cool, and I can't wait to meet them, and they gave me a hug, and it's just like cool, and I hung out with them. So they're my favorite. Paleo Women's Podcast, another one. There's not a whole lot of women's podcasts, which I don't mind, but there's a lot of men talking about a lot of women's stuff, and you're like, I kind of want a woman's perspective on that. Mind Pump Media, I don't know if you've ever heard of them. They're a bunch of bros, but they talk nutrition, fitness. They're really, really good conversations. They have really good people on their episodes. They do like 5 episodes a week, so it's really hard to keep up on them. The Minimalists, I really like them. I like what they stand for. Obviously, as a traveler, we kind of have to be minimalists. When me and my boyfriend lived in Grand Rapids, we were in this huge house, and when I decided I was going to travel again, we moved, and I pretty much was like, if I can't fit it in my car, I'm not going to have it. I do have a room at my parents' house, obviously, for my home. So I put stuff in there, but it's not like, jammed to the roof of stuff. So I just travel with what I can fit in my car. So it's really cool to listen to them. And then another one that a lot of people actually on this podcast who listen to you might like is Living Unconventionally. She is from Indianapolis, so near and dear to my heart.
Very cool.
And she talks to a lot of people who literally are like, I'm done, and I'm going to travel for the rest of my life, and I'm going to figure it out. And the things that I've learned from that podcast are amazing.
Awesome.
The fact that, did you know that house sitting was a thing?
I had heard of one person doing it, but I haven't got a lot of information on that.
It's crazy. Like, I feel like I've been doing traveling all wrong. Like, people put their houses up on this, it's called Trusted House Sitters is the website, and I think you have to pay a fee every month if you're truly interested in it, but I've looked at it, and these people just are like, hey, can you come stay at my house for a week? Obviously, it's a free stay. You watch their pets, watch their house, whatever. You have to apply and do stuff like that, but I just think that'd be so cool. A lot of it's international, but there are a lot in the States too.
Got it.
Stuff like that I've learned. There is an app too that I forgot to mention. It's called Skyscanner, and it is a flight app. So instead of using Expedia, I've used that, and that's just from her podcast. So those are like just a handful of them.
Yeah. Can you describe Skyscanner a little bit more?
Yeah, so it's a just kind of like Expedia, it's a search engine, but it's free, and they pretty much just look like, okay, you're going from point A to point B flight is this much, and point B to point C flight is this much, and this is how much it's going to be. Like, there's no fees or anything like that. Skyscanner is one of them, and Skiplagged, and what Skiplagged does is from what I understand, I haven't used them yet. I downloaded them. I've looked at a couple flights, but they will, like, if you have a flight connecting somewhere, like if you look on like Expedia or something, and they're like, okay, you have one stop here, blah, 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 whatever, they can connect your flights in different places. So it's just it's probably best more internationally.
Mm.
But that was another one that I downloaded and I'm going to play around with.
I recently had a conference that I went to in Tampa Bay, Florida, or near Tampa Bay, and skip lagged. I tried using it, I think 2 times now, and it was actually a little bit cheaper for me just to go ahead and go with. Usually it's like Delta or something like that,
Okay.
just straight through them. But they had a lot of controversy around them when they first came around. I'm trying to remember the guy. He's a younger dude. He just kind of started this as a college project. And what ended up happening is he was able to find the algorithms for or connect certain flights. And basically, if you say you're going from like St. Louis to Chicago, you'll get charged like X rate. But if you're going from St. Louis to somewhere in Minnesota, but you're stopping in Chicago, it might actually be cheaper because of your destination. And so what he does is instead of putting you on flight A, he'll put you on flight B where you're paying less, but you're still going to the destination. You just don't get on that second flight.
Oh, okay.
It hasn't worked out for me yet. And it might be so, like what you were saying, where international flights might be a little bit better. But he started basically getting attacked by all these large airline companies. And I think the process is still pending with kind of litigation stuff coming in for him. But so far, everything he's done has been legal, and he just seems like a humble nerd trying to get people to flights.
Help us out, yeah.
And sorry to cut you off there. I think you're in the middle of your list.
That's okay. So those are pretty much all the podcasts, and then the books that I would highly recommend to anybody. Can I swear?
Yes.
Okay. You Are a Badass by Jen Sincero. Me and the boy listened to this on our way to Tennessee, like an audiobook, because I do like to listen to audiobooks too, because I am in the car so much. And we were both like, it was like 10 o'clock at night, and it was like the end of the book, and we were like, whoa, like anything. This is awesome. So that's a really awesome book, especially for traveling, because it gives you that boost of confidence that you just didn't, that you needed. And then The Subtle Art of Not Giving a Fuck, which is an awesome book.
Mm-hmm.
I just really enjoyed it. It hit home for me. We're a very sensitive culture. That has to do with social media, I think, and the way kids are being raised. And he talks a lot about that, and just not caring a little less, but caring a little less about the things that we're so sensitive to. So it's a really good book. So yeah, that's pretty much the things I do. I usually have my aux cable always in my phone listening to stuff.
Okay.
Love music, but if you have a 4-hour drive, it's nice to just put some podcasts on or
absolutely
whatever.
Yeah, that's basically what I'm doing now. So I got an hour commute one way, and I just put in a couple podcasts. Sometimes it's a little bit shorter, and you get some music at the end, and then you go straight into patient care. So it gets a little ramped up there. But yeah, I've heard of both of those books, and both very, very good things. That you'll feel kind of empowered after it, and it's very get up and go and like go dominate the world type of books. And for our last question here, if somebody was on the fence of becoming a traveling respiratory therapist, what would you tell them?
Like I said, get your experience. Make sure that you're comfortable. You're never going to be 100% comfortable with everything, but you need to be comfortable with your skills, and the sense of if you get thrown into a situation, you'll know what to do for the most part. You'll always have people around you that you can utilize. But I would say that it's such an amazing experience that a lot of people don't get to do. You're literally getting paid to go travel. And there are pros and cons. I tell people that all the time. It's harder for some people. It's easier for some people. Like I said, right now I'm with some roommates. So it's been really awesome because I've already made 2 friends, and we've gone out and they've showed me the town. And you may not always be that lucky having roommates, but I've always found a place by myself for the most part. And it makes it a little more tough to see the area. I mean, you can go out and do your own thing, and that's kind of what I do. But it's nice to have someone be like, "Oh, this is here because of this," and give you a little history. So yeah, definitely get your experience and then just do it. Don't do it for the money. Obviously, it is helping me pay off my student loans a little quicker, but I am being smarter about my money. And you do have to duplicate your expenses. So you're not, I mean, it is a little bit more money, but the experience is really worth it too. There's places that you would never think of going, like Milwaukee, Wisconsin, that you're just the coolest city that I've ever been to. Like, it's really cool. So
awesome. Well, did you have any other messages or anything else you wanted to share with the listeners today?
If you have any questions about traveling, I'm an open book. I love helping people. I love networking with people. I love connecting people to other people. We're all one big family. I just wish everyone felt the same way. And that lady that you just interviewed, what's her name? Just released her interview, and she interviewed with Laura.
There's a few. It's either Carissa or Jess. Carissa.
I messaged her and added her on Facebook, and I'm like, listen, you keep showing up in my life. You're in right now. You're going to Indianapolis. Like, this is the world sign saying you need to say hi to her. And okay. She's like, I'm actually going to be in Wisconsin in a couple weeks. I'm like, what a small world. So you just got to be open-minded, and it'll just make life easier. Yeah. So, yeah, if anybody has any questions or anything, feel free to reach out to me, message me. I am by no means an expert. I am actually just decided as of today, I'm going to TravelCon in Las Vegas.
Awesome.
I found a ticket. A woman had transferred her name over to me, so I'm super pumped about that. I've heard it's awesome, so I'd highly recommend it. If you ever think you want to travel, I can let you guys know how it went, but I've heard there's some awesome information that's there.
Yeah. Well, I'll see you there because I'll also be there.
Yay!
And awesome. For the listeners, this episode will probably launch after TravelCon, okay. But hopefully we can all share some information on that. And if you want to kind of do that networking thing as a listener and get involved, join the group online, New Medical Nomads. I'm hoping eventually it'll get large enough and then we can do like meetups in cities and different stuff and just make a whole bunch of friends there and take care of each other. Or if you're looking for the next podcast launch, go to the New Medical Nomads podcast. Like and follow that, and then you'll always get the official launches that I do. Or if you go onto YouTube, kind of what Ashley did, you can see the launches and the videos before I officially release them. So if you subscribe on there, any type of subscribing, reviewing, following is going to help us get our information out. And so, share some love with us. We would absolutely appreciate it so much. But thank you, Ashley. And then if the listeners have any questions, if you're in that group, the New Medical Nomads, just tag her in a question, shoot her a message there, and I'm sure she would be happy to answer anything.
Yeah, thank you so much, Dylan.
No problem. Well, you have a great day or a great night. It is a little bit dark outside, and safe travels.
All right, you too. Thanks.